Hey everyone, this is Hannah with the Rocket Miner, giving you another video news update. Today, once again, I want to focus on COVID-19 and where we're at with that in Wyoming and in Sweetwater County. There have been some more updates and just more added to the discussion of where we're at and how we're responding. So I wanted to go over some of those things today and just share some of my own thoughts with you on them as well. To start off with, to give you an update on the numbers, they continue to climb significantly. They have gone up significantly again today. The Wyoming Department of Health is reporting that we are now at 21,047 confirmed cases and 3,406 probable cases. That means that we're up by 1,162 new confirmed cases since yesterday. That's, again, one of the biggest increases I've seen in a single day, if not the biggest increase we've had so far. Yesterday, we passed the 10,000 active case milestone. Today, we're up to 10,891 active cases in the state. That is 744 more active cases than we had yesterday. As far as Sweetwater County, today we reached 1,087 total confirmed cases that we have had. We are one of 8 counties that have over 1,000 cases. Thankfully, we're not close to 2,000 yet. There are several counties throughout the state that have passed 2,000 total confirmed cases, but we are still one of the counties with one of the biggest total case numbers so far. Today, unfortunately, the death total also rose for the state to 155 total deaths. This was after 11 more deaths were reported by the Wyoming Department of Health. The counties that these recent 11 deaths were in were Campbell, Carbon, Converse, Crook, Johnson, Natrona, and Sheridan. All of these deaths were among older adults. 6 out of the 11 deaths were residents of long-term care facilities. But among several of these 11 deaths, it was unclear whether or not they had any pre-existing health conditions that put them more at risk. So, as I said, those new 11 deaths that were reported brought us up to a total of 155 deaths so far for Wyoming. As far as things in Sweetwater County go and our local response to COVID, yesterday there was an educational meeting that was held through Zoom to address where we're at in our county and what we're looking into going forward. The meeting included local health officers as well as county government officials and other local leaders and officials. And this meeting was just a discussion of the effect that COVID-19 has been having in our county and the effects that we will continue to see from it, and discussion on how we should respond and what that will mean for us. It discussed how the increased hospitalizations and deaths that we've seen and that we will continue to see if cases aren't gotten under control will continue to affect our community, our healthcare, education, industry, the judicial system, just the overall quality of life for everyone in pretty much every sector of our lives here in Sweetwater County. It was noted during the meeting that other places around Wyoming are starting to be overwhelmed, especially hospitals, people doing contact tracing, school systems, things like that. And the health officials for our county warned that that could easily happen here, that we're kind of on the road towards that happening. And as we've seen it around the state, it's getting closer and closer to us here as well. Dr. Jean Station, our Sweetwater County health officer, spoke a lot during the meeting about her perception of where things are at, and she noted that the advice on how to contain the virus has always remained the same, but people just aren't taking the precautions that they need to. They aren't following or listening to that advice, so the cases keep spreading. Knowing that, seeing the rise in cases that we've had here locally, Dr. Station explained her reasoning behind why she has asked for a mask mandate, and that's both locally and the state. She was one of the health officials who signed the letter to the governor that we talked about last week that was sent asking for a statewide mask mandate. She did put her support behind that, but she also has specifically requested a mask mandate for Sweetwater County, and that is pending, along with several other counties have also recently put in a request for a mask mandate, and the Wyoming Department of Health noted those counties, said that those requests are still pending, but that several have asked for that. And Dr. Station explained that she put her support behind the statewide mask mandate, but also did request one for our county, since at this point the governor still hasn't released his newest health orders. Those should be coming out pretty soon. He said that he would be giving new and updated health orders. Dr. Station said she expects this to include things like reducing gathering sizes, and that it might possibly include a statewide mask mandate, but that's not sure right now. And up to this point, the governor has been leaving that up to individual counties. So that is why Dr. Station went ahead and put in the request for that for Sweetwater County. Dr. Station pointed out that right now a lot of people who aren't following these precautions, who aren't really taking things seriously, she said there are still people like that, and she thinks that eventually it will get to the point where they understand what's happening and that they will take things seriously and take precautions, but that might not happen until it becomes personal to them and someone in their family gets COVID or someone in their family dies from it. And she noted that it's hard for us to wait that long, and how many people will have to die before people start taking things seriously and start taking precautions. So that's why she understands the controversy of asking for a mask mandate, but she felt that she was doing the right thing in requesting that to protect people in our community. During the meeting, as I said, there were lots of city and county officials on different levels, and there was a lot of discussion on a mask mandate, what that means, what that would actually look like for us here locally. And a lot of officials brought up enforcement concerns, and how trying to enforce a mask requirement could add extra burdens to our law enforcement, to our judicial system. There was discussion of how if a mask mandate was taken to its full extent or extreme and it included the possibility of jail time, how that could mean more people in jail, which could mean more trials, which could be really hard for the judicial system, and also, yeah, just hard for law enforcement to keep up with enforcing this as well as all that they normally do. So there were concerns, and those were discussed and talked through, but the health officials locally were still supportive of a mask mandate for the concept that this will help bring our cases down. Dr. Station pointed out that other areas that implemented mask requirements saw huge improvements that came from more mask wearing. And she pointed out that an improvement of even 10 or 20% of the population wearing masks would be seen as a win, and even just getting more people on board is going to help us improve. Sweetwater Memorial and also the Castle Rock Medical Center team pointed out how their mask policies have helped limit and control the spread of COVID, especially how, like, at the hospital and at Castle Rock, they haven't seen cases of infections spread from patient to provider or provider to patient because they were wearing masks. And they just pointed out how that shows, and how even at schools where masks are required, there have been less cases and not cases spread through the schools. Most of the cases we've seen at our schools have been acquired somewhere else, and so it's been through community spread, not specifically at the schools. So there is evidence even locally of how masks can help, and there is research to back up the concept that masks do help contain and control the spread of COVID-19. Health officials also noted that a lot of the new cases that we see and the spread that we're seeing locally is probably resulting from small social gatherings, people getting together with friends or with extended family and just letting down their guard in those settings and going ahead and having parties or going to bars and not wearing masks, or those kinds of cases where we see people getting together in groups, not taking precautions, not being as careful, and that's where it starts spreading. Dr. Station also pointed out that even as we take more steps, even if we have something like a mask mandate in place, it takes time to see that effect happen. It takes time to see a change. So it's important to keep in mind that numbers don't change immediately. And this is important to think about with the cases going up and with trying to bring them down, is, like they said, how much cases have increased over the past 11 days. And just looking at that time frame makes me think a lot of new cases we're seeing are from Halloween and Halloween events where people weren't taking precautions. But then also, as we start taking precautions and putting things in place to try to bring the numbers down, we have to remember that that's not going to happen immediately either, and it could take several weeks to start seeing that come back down. So it's something that is just important how we think about it, and that we're not expecting instant results, that we know that this is going to take time, that it's a process, and it's something we need to just stick with and keep doing in order to see something change. So those were a lot of the thoughts that were discussed during that meeting. We have a story that includes even more details on that meeting that's at rocketmeyer.com and will be in the newspaper. So you can always check those for more information, as I said, about this meeting, and then also other things that are happening around the state with COVID, other counties' responses, what they're going through and dealing with. But as I was thinking about the points that were brought up, I think that obviously there is a lot to consider here. I know that a lot of people, especially in Wyoming, are against having a mask mandate. I know a lot of people here locally don't want that. But I think it brings up important questions that have been part of this discussion. And I've heard a lot of people talking about not wanting to wear masks for various reasons, either because they don't think that they're effective, or they're concerned about people who might have health problems that would prevent them from wearing a mask, or just that they think it's a personal right and it should be a personal choice and not something that's mandated. I think that's one of the biggest arguments. Regarding that, I would say that I believe there is research to back up that masks are effective. As several of our health officials brought up, I think we've seen that locally. I think there's also research on a national level to indicate that, and that's what a lot of health professionals are saying right now, is that masks do work and do help. I know people are concerned that there are people with different health problems that wearing a mask is hard for them. I understand that that's a concern. I understand there will be exemptions. I also think there are other options available, like face shields. There are options within that, and also it's pretty rare. Most people, the majority of people, their health will not be negatively affected by wearing a mask. And for those who it will, I think there are other options. I think the biggest argument being whether or not this should be something that is mandated, that people are required to do. Lots of people say it should be a personal choice. It's my personal right to decide whether or not I want to wear a mask. And I do think that personal choices and rights are very important and should be protected. But I also think that this is a case where personal rights and our own freedoms to do what we want do not include the right or the freedom to put other people's health and lives at risk. And I keep coming back, I discuss this a lot with people, I always come back to the analogy of wearing a seatbelt. Wearing a seatbelt is something that is required by law, that you can be fined for not doing, that is a part of what we enforce and what we mandate for people. And when you're wearing a seatbelt, if you don't wear one, the life that you're risking is your own, and we still mandate that. So how much more if the actions you're doing could risk other people's lives and health? And other people have argued, I mean, since the beginning with COVID, that, people die all the time. People die from the flu, people die from car accidents, people die from XYZ. And yes, that's true, but we also do what we can to prevent those deaths, like car accidents. We have seatbelts. We do things to try to prevent deaths, to try to save people's lives, to take the actions that we can to protect and preserve life. And I think that COVID is no exception to that. If anything, it's more because it kills more people than the flu. It is a greater risk than so many of these things. And once again, one person's actions affect so many other people's health and put other people at risk as well. So I think it is something that I wish people would do what they're supposed to. I wish it didn't have to be required or mandated. But we've seen over the last few months that just asking people to take these steps is clearly not enough, and it's not accomplishing anything because some people won't if they're not required to. So I know that there's a lot to consider with this and a lot of big questions that tie into this, but I do think that it's important that we do what it takes to protect people and to save lives. I also think that a lot of people are thinking, well, I don't want to wear a mask, I don't want to have to social distance and not go to gatherings because this is messing up my life. My life is no longer normal because of these things. But the way I look at it, our lives are not going to be normal, and they're going to get even further away from normal the more COVID spreads and the more it gets out of control. The less normal our lives are going to be. And it will just keep going indefinitely. I know that wearing masks, not being able to go to big concerts and events and sports like we used to, things that we used to enjoy, that's hard. Nobody likes that. Nobody's having a fun time with this. But I also think it's important to realize that the longer we don't take precautions, the longer this is going to go, and the longer it'll take before we can get back to that sense of normalcy. And if we take precautions, like wearing a mask, we can still do a lot of things. It's a slight inconvenience, it looks a little different than it used to, but we can still enjoy things and do a lot of things. But if we don't do them, things will continue to be overrun, our hospitals will be overrun, it will continue affecting our lives in much more drastic ways than just having to wear a mask will affect us. So I think that those are important things to keep in mind and to think through and to realize. I really think that at this point we need to accept the seriousness of what's happening, accept the reality of what we're going through and what it means for us. We need to take it seriously, listen to professionals, especially health professionals, and take the steps that we need to take and be willing to do what needs to be done so that we can get this under control and we can help protect people's lives. So thank you for listening to my thoughts. Those are things I wanted to share with you today, and keep checking back with us for more news and updates, and I hope that everyone has a good night.